This episode of Let's Talk Natural Medicine is brought to you by BioGland MedLab, proud platinum partners of ATMS. Built on 50 plus years of healthcare experience and nutritional science, BioGland MedLab delivers practitioner-only formulas, trusted by practitioners, loved by families. Welcome back to Let's Talk Natural Medicine, brought to you by the Australian Traditional Medicine Society. I'm your host, Natalie Hume, and today we're addressing a topic that impacts millions of people worldwide: chronic pain. Pain management is essential for quality of life, and natural approaches can be really effective and a great solution for chronic pain. From herbal remedies to mind-body techniques, there is a range of options to help manage chronic pain holistically. And today, our guest is going to be going through that with us today. We have Brendan Meek joining us. Brendan is an acupuncturist and Chinese herbal medicine practitioner, and he'll guide us through some natural techniques that can help ease pain and improve well-being. Thank you for joining us today, Brendan.
Thanks, Natalie. Nice to be with you. It's been a while since we've caught up, but yeah, good to see you on the digital version.
Yes. And it's great to have you here from obviously the acupuncture side of things, Chinese herbal medicine. And as you said, chronic pain is huge, isn't it? And can we maybe begin with explaining the types of pain that you see as an acupuncturist, and how can it help relieve some of this pain and issues that people are experiencing?
Yeah, I guess we could probably subcategorize it first. That's probably the way I think about it. So, you'd have acute pain, chronic pain. Then you can go into things like nerve pain or visceral pain, so problems that are inside in the organs. So, some of the basic things you might see is sporting injuries, like on the acute thing that someone sprained an ankle or they've hurt their elbow and so forth. Then you might move into the chronic phase of things where you might have things like tendonitis, so like tennis elbow, plantar fasciitis, Achilles syndromes and so forth. Then you can get into the nerve pain types of scenarios where you've got things like trigeminal neuralgia, sort of stubborn things to treat, migraines, sciatica. And then moving along back into the visceral things, you can get things like period pain, and people have things like ulcers and so forth that present to clinic. So along with their, let's say, their general medical advice or whatever they're taking at the moment, we can use our treatments concurrently, or sometimes some patients, clients, they choose to use solely natural medicines.
And do you see a lot of them that we can see as patients are aging or we're aging, you get that degenerative stuff from arthritis or osteoarthritis, rheumatoid arthritis as well?
We're getting wiser, Natalie. There isn't age-related thing, but I'm just going to say we're getting wiser. But yes, certainly young. Look, we don't regenerate as faster as we're getting on, let's say. So that can compound things. But I think if you even look in time, in what would you say, in relation to even the exercise field, that elderly individuals can be very, very strong. So you can maintain your intensity of your strength in your body, which is a really important factor. The problem that you have when you're getting on is recovery. So you might use the statement that volume kills. Anything that's volume, in the direction of volume, too much over a short period of time, you can't recover from. So this is a really interesting factor. We can retain a certain high degree of quality. We just can't have as much. We've got to walk that kind of golden mean, that middle road of things. We can still have the good stuff, but we've got to be kind of careful about the volume, the indulgence. Otherwise, it's going to exacerbate pains we already have. We're going to find it hard to recover from. So, I'm going to get a little bit as Confucius says, but you can guess that, the major principle of the universe is change. It's a changeless change. So we have to change. If we want something, if we don't want to have pain, then we may have to change something. That may mean seeking treatment, or we may have to change something about ourselves or our lifestyle.
Some people are quite reluctant to change, absolutely. But how can, I guess, acupuncture really help with these, from the
sprained ankle, sporting injury, where there might be a lot of bruising, swelling, heat. Can people go seek out acupuncture at that stages too?
Yeah, for sure. So we probably should break down a little bit how acupuncture works so we can get an understanding of how it might help. So let's say that in the body you've got, we do have, so not let's say, we've got internal organs, and each of those internal organs, they connect to a circuit. So those circuits are what we call the meridians. So, they travel from the end of the fingertips up the arm, and in this case, let's say it's the large intestine. It goes up into the face, into the teeth, the nose, drops down through here in the clavicle, and connects to its home base, the large intestine. So that's kind of how the meridian system works. Now, along the meridian system, you've got the points. Everyone's familiar with probably pressing certain points to relieve headache pains. So this is where, let's say, the flow of energy comes to the surface, and we can manipulate it either by acupressure or using needles in this case. So then we can move to the idea of, well, how does acupuncture then relieve pain? So we can consider that all manifestations of pain in the body are a representation of either the blockage of energy, blood, or fluid. People sometimes forget about fluid being an aspect of pain. But I would ask anyone that knows someone with fluid retention, or particularly if they have fluid retention, just press down the inside of your shin. You'll find it quite tender. See, the thing is, when there's a lot of fluid in the body, it'll press the compartments inside the body out, and it will press on the nerves. And those nerves will be quite sensitive to touch. And in fact, I'd say systemically that it makes those patients even just generally nervous. Having fluid retention sort of ups the ampage, if you like, the wattage in their nervous system. They already generally can feel a little bit nervous. Okay, so let's move back to how this would play out in treatment. So, as you said, you gave the acute scenario where someone's had a sprained ankle, and quite rightly, if something's red and hot, you don't want to poke around it to aggravate and make it worse. Now, the interesting thing about the meridian system is that it's bilateral, so that what you do on one side affects the other side. So if the left-hand side, let's say wrist in this case, is swollen from some sports injury, you don't need to treat that side. You can simply treat the other side. So this is a safe way of intervention where you're not aggravating an existing condition. You're helping it heal by using the healthy side. Now, listeners might think, well, how can that work? Well, it's already working if you understand the body's anatomy and physiology. So, for example, we already know that the left eye is controlled by the right rear hand side of the brain. And if you have a stroke, let's say in a pathological sense, if you have a stroke on the right hand side of your brain, you lose movement and function on the left side. So the body already has this mirroring system in the body. So we're just taking advantage of that in treatment. So how would we conclude this? We'd say that it's not to be concerned with making the injured site worse. And it's not to say that we never treat the injured area itself, but we can use other areas away from that area to facilitate healing.
Mm-hmm. I love that. And that was so fascinating how you explained that you can treat the other side of the body. I love that.
Well, this is Natalie. This is what's, yin yang is a bit of a mystery, right? They're talking, yin yang, and so what the hell does that mean? Like, did I order that last week at the restaurant? What's going on? It's the system. It's the understanding of polarities. It's the relationship between polarities. It's male, female. It's up and down. It's left and right. It's hot and cold. And it can be a simple way of understanding. Sometimes you can't oversimplify things, but sometimes when things are complex, you need to reduce it back down to the simple. The body can only understand so many messages. And that's something to be aware of as acupuncturists. If you start using a million signals, the body gets confused. You need to use simple signals. So sometimes in treatment, I only use 1 or 2 needles. But the idea of that is to give a simple, clear message. Now, the secret of that is your manipulation, how you move the needle. So Putting a needle is one part, but it's what you're doing with the needle and how you manipulate it to help foster that healing process. So to give you a little bit of example, and let me know if I'm getting carried away on this example, as you mentioned. So if we'd imagine the body in an acute emergency state, and if we use an analogy, let's say this building was on fire that I'm in right now. And if I gave someone the instruction, okay, look, you need to go out the door, go down the second set of stairs, and when you hit the exit of that stairs, then turn right, go up, turn left, and go out the third door to your right. Versus,
You lost me.
correct, versus the building's on fire, go out the door, turn left and go down the stairs. It's obviously the second instruction. And that's what we want to do with the body. And as therapists, I would say as well, and as clients, patients as well, we want to give clear, direct, simple instructions to the body of what to do. Should it sweat? Should you help it facilitate bowel motion? Should you help it to tone down its nervous system? Should you help stimulate it to turn it back on? All these things are processes that the body has its own natural way of healing. It just gets stuck sometimes or weak. We've got to help send a signal to reboot it and say, hey, go that way. And then it will click on, say, oh, okay, yeah, I got it. I can take it from here. Thanks for the signal. That's the idea as a healer. We stimulate that process back to normal functioning.
I love that. And obviously in clinical practice, it seems you're very passionate about helping not only chronic pain, but obviously a lot of other conditions. But with your chronic pain patients, what else can you do to help them, to support them, to facilitate them to, reduce that pain naturally? So lifestyle things, what else would you help to support them as well, or suggest to them?
Well, I do like the ancient Greeks, so I have to talk about Hippocrates. And I think I've mentioned that in the blog that I've sent to you previously. But the first thing I tell people is stop hurting yourself. So first, do no harm is a really important ingredient to self-treatment. So we're often looking for something and distrusting our own intuition. Oh, what this thing helped, this turmeric latte, and they're all fine. And it's not that those things don't work, but my idea is to return people to their own wisdom of their body. Something, you know what you're doing to yourself that's hurting yourself. So just stop doing it. Why don't you just stop doing that? Yeah, you just stop doing those things. So see what those things are. And look, those things can be on the emotional level. Maybe you're continually indulging in being resentful. So you might have to tone it down. You might need to back it off a little bit. I mean, some of those habits are hard to stop. And I'll get into reason why that can be helpful for pain later on. But, there's certain things that you're doing maybe dietary-wise. You don't have to get too technical, but you know that each meal that you have, you're overeating. So tone it down. Why don't you eat to 80% full? You know that you're staying up till 11:30 at night. Yes, you've got a shoulder pain, but you're not facilitating good recovery there. So why don't you stop hurting yourself by going to bed late? So the first thing I would say is stop hurting yourself. First, do no harm. So a little extension on that, if you'll allow me to indulge my philosophical proclivities. So there's a concept called thank you. There's a concept called Wu Wei, which means non-interference. So this is one of the biggest principles of Eastern medical thought. So it means allowing the natural flow of things to resume. So those that might have worked in the corporate sector or with a particularly really good boss, they might have noticed that a really good boss does not need to scream and shout. His or her presence alone, saying nothing, should reorganize people into doing their correct jobs. They know that the boss is competent, and his presence or her presence alone should facilitate the correct action. So this is the same thing in treatment. Like, it's going back a little bit to the yin yang principle as well. We don't need to interfere over here with the wrist that was injured. Let's already facilitate what's good to help harmonize what's incorrect. So Now I've got to ask you again. What was your question? I went off on such a tangent there. What was what was your original question?
We were talking about the whole lifestyle side of
Yeah.
things. You know, what can we do? Which you've touched on as well. So maybe we might move on to more. Yeah, you go for it.
Sorry.
You've got another one.
Well, I'm drinking something, so you say, look, let's say in terms of if we're looking for actual, let's make it a little bit more concrete for people because I went a little bit too philosophical there. So we've got to bring back to the pragmatic, let's say. So on the very basic level, without looking at each individual supplement, there's two major flavors within the Eastern medical pharmacopoeia, medical herbs and dietary therapy that are most important. The first is the pungent flavor. Pungent disperses. Yeah. The second is sweet flavor. Sweet relaxes, but it also nourishes. So if we can grab hold of these two flavors and utilize them, that's also helpful in terms of mitigating pain. I don't really like the turmeric lattes. I've had one. They're not too bad. But look, if you have a look at the chai lattes, and I haven't got, look, this may be a call out to any chai suppliers there that I'm giving them a promotion. But if you look at if you look at chai, you've got some great examples of pungent herbs in there. You've got cardamom, you've got cinnamon, you've got ginger, and it's a warm drink. The sugar, the abundance of sugar at times may let it down, but a little bit of honey is good too. So there's one encapsulation there. If you want to break it down more simply and have some direct pain advice, I'd say let's go back to physics. Heat relaxes and expands. Cold contracts and makes tense. So if we want to relieve pain, open things up, heat's usually a good place to start. So it can be as simple as hot water. Hot water is virtually free. You know, it doesn't cost you it's 1 or 2 cents. And it provides the heat that will help relax into the body. Now, the interesting thing about using heat and putting it into the stomach is the stomach's relationship to the body in Eastern medicine is to do with earth, and earth feeds the 4 sides, the 4 limbs, and its relationship to the muscles. So if you've got stiffness in the muscles and you relax the stomach with heat, the other muscles should have a reciprocal response. Now, on top of the hot water, let's power this up. Let's not have the moderate version. We want the super duper hot water. So what would I do to that? Hot water can be a little bit drying if you're having too much of it. So whack some honey in there. Now, what does honey do? Honey is sweet and it relaxes. Okay. Now we want to super duper charge a little bit more. Get some ginger, cook that up with your hot water, and then pop some honey at the end. Now you've got the heat, which relaxes. Now you've got the pungent, and now you've got the sweet. It's a very cheap drink. You can make it at home. Yeah, and it's well, I was going to say it's sugar free. It's not, but it's a better version of sugar, right?
Yeah, honey, absolutely, rather than the real, table sugar, absolutely. Yeah. And you've mentioned some herbs there as well. So I love those, bringing herbs into cooking, bringing herbs into tea, relaxing the muscles and adding heat. So they sound like some great things that people can do at home if they've got chronic pain.
Yeah, sure. And it's easy. Boil the kettle. Yeah. I've just done it before.
Yeah. Amazing. So
I'm feeling so much better.
I'm going to bring up a bit of a fact or fiction segment now. So I'm going to share a common, maybe a belief or disbelief about natural pain management. So can you tell us if this is fact or fiction? Natural remedies aren't strong enough to manage severe or chronic pain.
Oh, yeah, really good question. Contentious, but answerable. So what I would say there is, look, being in clinical practice for a while, it was more than 20 years, what I would conclude there is there's certain pains that the surgeon can't heal, and there's certain pains that the shaman or the faith healer can't heal. I think the problem's been with the advent of modern medicine that we've thrown out the shaman or the person that soothes ears and so forth, which is the first type of healing, really. Okay, so let's unpack that scenario of not being able to treat severe pain. And I'll use some clinical examples as well. So obviously, if you've had some sort of catastrophic car accident or something and your leg's chopped off, you don't really want the shaman there trying to help you out. I mean, he could probably help facilitate, shuffle you off the mortal plane into the next spiritual realm, but he's probably not going to be able to save you. So that's where you'd want the surgeon in that case. That's their specialty, emergency medicine. But on the flip side, in clinic, it's many a time I've seen clients having gone through surgery, the strongest pain medications you can imagine, and their pain levels are still at 7, 8, 9s. Okay, so you've got the best of Western medicine there not able to solve. And what I would say is sometimes a lot of these cases, that pain has now entered the domain of the heart field, you can say, the heart space, the mind space, the conscious space, and now they're intertwined. It can't be just suppressed at a level of medication. So treatment has to be quite comprehensive in terms of, yes, we're opening the energy and the blood circulation, the meridians, but you also have to somehow influence the person's sense of ease, return them back to their sense of self, happiness, and so forth, so that the disease starts to unknot itself from the mind and the person's identity. So this is a type of severe pain that the surgeon is not able to touch. So let's put it in conclusion, I'd say that we've both got our own strengths. You have to know when to use one or the other. And it's a matter of, I'd say, wisely knowing when to use both. And sometimes you don't know when you're in pain. You've lost your sense of what's right or wrong, and that's when you need to reach out to, other practitioners, be they conventional or natural health.
Not just trying to do it alone. Absolutely. There's so many different therapies, natural therapies out there, along with obviously the medical approach that can really support them. So,
look, that's 100%, Natalie, and pointing out to my article, which is non-paid for, and we're not accepting any payments for those articles. But I did make a note in that article there that it's not about really choosing one or the other. It's about knowing how to use both in that sense.
Yeah. And so for somebody who's maybe listening to this, thinking, yes, I've had chronic pain, I've had frozen shoulder, or I've had that car accident, years ago and still experiencing chronic pain, what would the first steps be that you would recommend?
In terms of having treatment or even prior to treatment?
Yeah, just what to explore natural pain relief. How would they start to explore, I guess, natural pain relief for them stuck in that vicious cycle of chronic pain?
Okay, so I'm going to give the unsexy answer first, which is first, do no harm again. Because what I see time and time again is that patients will self-medicate in a position where they don't have clinical experience and they're in a subjective position of not being able to see their pattern clearly and how they may be impacting themselves by self-medicating. Now, there's some exceptions to that, like some simple things like maybe a little bit of magnesium and even the suggestions I use. But once you get into serious pain, you don't want to start complicating and making things worse by self-medicating. Google's helpful to give yourself some roundabout ideas of what directions you may take and what might be possible. But you know yourself with herbs, and I've been doing herbs for more than 20 years. I find it very difficult to treat myself, and I treat people all day, 5-6 days a week. How the hell can someone who doesn't do that have the clarity to treat themselves? So bringing it back nicely, I'd say, please don't hurt yourself first. Seek help if you're looking into the realm of herbs, because it's not that easy, number one. Number two, I'm going to probably say something maybe a little bit more woo-woo, which is if we look at the deeper pain states, we have to look back. Well, first, I'd like to look back at, let's say, COVID scenario. What I noticed during COVID was that people were coming to me and saying that, first of all, my anxiety, I've never had anxiety, and now I'm very anxious. And a lot of their pains were also getting worse. And what I noticed was that people had reduced their interactions. So they are no longer having meaningful interactions with individuals. They were shutting down. So looking at this further, I thought, well, what's happening here? So if we look at Chinese medicine, we know that the heart, often the organs are ranked in terms of the general and the emperor and the prime minister. So basically the heart is the king. Okay, and the heart stands for a feeling center, but also aspects of consciousness. Importantly, it masters all the blood vessels. Now, where do all the blood vessels go? I'd ask you, where are the blood vessels? Are they only in the shoulder?
Everywhere?
They're everywhere.
Everywhere.
Exactly, they're everywhere, right? So do we want to treat everywhere? Yeah, let's treat everywhere. So how do we tap into the heart? Well, then we're almost getting a little bit shamanistic because it's not something you touch quite directly. It's something that we can influence, but it's ourselves. It's how we connect with others. So back to my woo-woo suggestions, if you're in chronic pain, you need to start moving your feelings. Yeah, you need to, I wouldn't say you need to because that's a little bit authoritative, but I would suggest that people start acting with a little bit of service, a bit of kindness, some gratitude. But at the same token, sometimes people have problem sometimes accepting feelings. So get in the habit of saying, thank you so much. I really appreciate that gift that you're offering, that gesture that you made, so that you're allowing the feelings, because feelings should move in and they should move out. Some of us do well going out, particularly practitioners. We give a lot, but we may not do very well receiving in. So we've got to practice that. So thank you so much. And then also offering something as well. So what I'm saying there is we need to get our feelings moving so that we can have better control and relaxation over our blood vessels, number one. If you can't do that, if that's like, wow, you're heading me down Mills and Boone, that's too scary for me. Okay, listen to some music. I'm not talking about whales, flutes, and you know all the stuff that's that you don't like, but it sounds relaxing. If you like AC/DC, listen to AC/DC and sing your lungs out. If you're like Gloria Stefan, do that. So, because its feelings are very personal. So I would say music is something to look at and enjoy that. And if you've got a creative ability like art or something, do that too. Now, someone might be thinking at home, yeah, but I got pain now. So, yeah, but this is a process. You might have had pain for a while. You need to start shifting your mindset now. And, hey, you might even start enjoying yourself a little bit and forget about the pain. So, but that's what I would say to start to do. Start to get back to yourself, your center, and get out of because pain can produce a lot of negativity. So you want to get back to your sense of self.
I love it. Thank you so much, Brendan, for joining us on the show today and giving us a bit of a insight and explanation how acupuncture and lifestyle can help support chronic pain. Thank you.
Thanks, Natalie, and I appreciate you too.
And thank you to our listeners for tuning into this episode of Let's Talk Natural Medicine. For you to find a qualified practitioner, please visit atms.com.au and click Find a Practitioner. Don't forget to sign up to our Friends of Natural Medicine newsletter for more tips, natural remedies, blogs on pain relief and wellness. Before we end up, let's wrap up with some quick wins for managing pain naturally. Incorporate anti-inflammatory foods, maybe like turmeric, ginger, warm water or hot tea, or honey, as Brendan suggested. Try gentle stretching movement, or as we said, to talk about feelings, connecting again with other people, and maybe consider mind-body practices like either meditation, acupuncture, or putting on your favorite song and rocking out in the kitchen. So thank you again. Until next time, take care and stay naturally well.
Join us again by following us for more uplifting discussions on natural medicine and holistic well-being. And if today left you inspired, share the love with a 5-star review. It helps others on their wellness journey find us too.